Ventriculomegaly, the diagnosis of ventriculomegaly is basically refers to enlargement of the ventricles within the brain, which are normal structures where cerebrospinal fluid is formed. Ventriculomegaly refers to enlargement of those spaces either because the tissue around the ventricles hasn't grown in fully, leaving the extra space filled with fluid, or because the fluid drainage has been obstructed and therefore the tissue is pushed away by the dilating ventricle. The term ACC refers to agenesis of the corpus callosum, which is either absence or incomplete formation of a major structure in the brain, the structure being the corpus callosum, which connects the two hemispheres of the brain, the right and the left hemispheres, and allows them to communicate with each other. The surgery is only indicated for ventriculomegaly if there is obstruction of fluid drainage. And in that case, the surgery would be some decompression technique. If there's obstruction of flow, we can use a diversion using a thin cannula which is placed within the ventricle and which allows the fluid to be drained by an alternative route to another body cavity such as the peritoneal cavity in the abdomen, so that we're bypassing the obstruction. That approach is used after the baby is born. There is currently no treatment to restore an incompletely formed corpus callosum. It is a very fundamental defect in the formation of the brain, where fibers that cross from one hemisphere to the other are interrupted in that process. And so what happens then is that those fibers find alternative places to migrate to, and restoring their normal pathways of migration is not possible currently. I think that first of all, both of these conditions, particularly together, constitute one of the most common reasons why we as neurologists are asked to see couples with affected fetuses. It is both of them in isolation and particularly together form the most common group of conditions, brain conditions, that are detected antenatally. I think it's very important for parents to realize that the outcome is not automatically dismal in this when you get this diagnosis, and it's important to work through a rational diagnostic process in order to try and determine where we think the baby is going to end up in terms of long-term outcome. It's obviously devastating for parents to hear this diagnosis, because anything associated with a brain abnormality carries a very highly charged reaction. But as I said, there are some children that do very well and that are indistinguishable from other children. Our job as neurologists and as fetal specialists is to try and best determine for the parents where we think the child is going to be on the spectrum. Of course, a lot of it depends on how, getting information after the child is born on progress and so on. But we're pretty accurate at being able to place these children somewhere within the broad spectrum of outcomes before the babies are born.